Hi, y'all. I'm Dr. Eva Taylor. I work out at our Sammamish office, our Allegro Sammamish. And just like she said, we're talking about menstrual and birth control options today. So, polling question to start us off. I truly could talk about this topic for probably hours, probably hours. So, this just kind of gives me a sense of maybe where I should focus in a little bit, where I should go a little bit more broad, and kind of spot on, something this will be more of a broad overview. So to delve into a little more detail, we'd love to talk to y'all and kind of personalize it for you and your kid, teen. Yep, agreed. All right, cool. Then my present. So generally, we all said kind of general curiosity, knowledge. So presentation should be spot on today. All right. Oops. Now I'm gonna click back. All right, fantastic. My outline was already going to be what is kind of normal slash typical menstruation, normal menstrual cycles. What should we expect? What raises a flag? And then when we need some sort of either birth control or menstrual regulation, what are our priorities? What are your pros and cons? How can we access those options? And there'll be, just like Candace said, there'll be some time at the end for questions too. So what is normal slash typical? This is really variable for every person. So I'm going to give you some general kind of when we would like to see you to talk about things, but it's also very individualized. If there's something that seems to be flagging you, we'd love to talk about it. So in general, frequency wise for periods, if your period from the first day of one period to the first day of the next period, if it's less than 3 weeks or more than 6 weeks, that's kind of a flag for us. Maybe we should talk about that. It's the amount of variability is, there's not really a hard and fast rule on that. So we'll talk about it a little bit more on the next slide. But if things are just wildly unpredictable for you and that is not working in your life, come talk to us. Heaviness wise, if you are having big blood clots, so like stuck together blood, bigger than a quarter, realize we're not all 100%. We don't use quarters very much anymore. So about yay big or bigger, if that's happening frequently, or if you're really soaking through a pad or a tampon every couple hours, that's a little heavy. Duration, if your period's lasting more than about a week, that's a long time. And then pain is a hard one, it's really subjective. So the guidelines say if it interferes with a patient's physical, social, emotional, and or material quality of life, let's talk about it. And so the same could be said for the frequency, the heaviness, kind of all of the above. If it's not working in your life, let's talk about it. Let's see what's up. Pertinent to this would also be how long you've had your period for. So when your period first started. So next polling question, also anonymous. So from when you've had your first period, when do I typically expect your periods to kind of regulate, to kind of become regular? This one gives me a chance to slow us down. I get excited about the topic, and sometimes I breeze through it a little fast. So if you hear me getting too fast, Hannah, let me know.
Yeah, it looks like our polling questions, there's a bit of a delay on there. So
Okay.
I'm trying to give everyone enough time to answer, but here's the results for that one.
Hey, yeah, it's a pretty good guess. So typically it's 1 to 2 years. So y'all are spot on. Up to 2 years for things to kind of regulate. So things to think about when we're thinking about periods being maybe a little bit off or maybe not where we expect them to be. It could just be the beginning stages of puberty, that first year or two when your body's kind of trying to figure out what it's doing and how to regulate things. But the same thing holds. If your periods are super frequent, they're super heavy, they're just ridiculously irregular. If things aren't, they're ridiculously painful. If something's not seeming right, let's talk about it. So there's a lot of things that play a role in your periods and kind of how they are. Nutrition, stress, exercise. You can truly be affected by the hormones and the cycles of the people around you. So you'll hear about, people in the same household all kind of cycling together. It's a real thing. It definitely can happen. So things like, for example, oh, hold on. There we go. Let's see if we can. All right, fantastic. So, for example, people with really painful cramps. Sometimes, honestly, getting enough sleep, enough fluids, enough exercise actually makes a difference in painful cramps. This is not to say, so you see on the bottom there, there's some other things that we think about when periods are just really haywire. So that is not to say that someone with true endometriosis having painful periods just needs to get out and exercise more. But you will notice that when you're active, the cramps are actually better and the bleeding can be lighter. Sometimes it's heavier in the beginning and then it kind of lightens up. Things like nutrition. If your periods are getting really light, they're kind of starting to go away. Sometimes that means your body needs a little more nutrition, or maybe the balance of nutrition and exercise is a little bit off, or potentially the kind of nutrition in the foods that you're eating isn't quite on par for your body. All of these are things that play a role, but if when you come to us and say like there's a period issue, so usually most people will kind of say in their comment when they're making an appointment with us, it's period issues, it's period concerns. And so we'll think about things like a hormone imbalance, a thyroid problem, or PCOS. These can cause irregular periods. We think about things like endometriosis that cause really painful periods. If your bleeding is really heavy or you have those big blood clots, sometimes people need to be tested for like bleeding problems or kind of clotting problems. So all of this is stuff that we will think about when you come and see us. And sometimes we do things like blood work. Sometimes we do things like ultrasounds. Sometimes we do a trial of treatment options and kind of see how your body responds. Often our first line is ibuprofen, which sounds kind of silly, like, oh, I take ibuprofen, I take Tylenol, like, oh, sometimes I still have cramps. Ibuprofen and naproxen, the NSAIDs, have an anti-prostaglandin effect. And so the prostaglandins are chemicals in your body that trigger the cramping and the bleeding of a period. And so at certain doses and certain frequencies, we can actually use ibuprofen and naproxen to decrease the prostaglandins, to decrease the bleeding and the cramping, which sounds a little counterintuitive. We all hear that ibuprofen increases your bleeding, but in this instance, it's actually really a useful tool. Again, this is not to say that somebody who is incapacitated for 7 days of their period just needs to take ibuprofen, but we have a lot of tools. We have a lot of kind of options to work with. So when things like, exercise, yoga, heating pad, ibuprofen, when this kind of stuff is not working and periods are still just kind of haywire, we start talking about kind of hormonal regulation. And basically all of these options, all of these kind of hormonal regulation options, we talk about them for period regulation, for cramps, for periods that are too heavy, periods that are too irregular. We talk about them for acne. They also function as birth control. And so it makes it a little bit more of a loaded conversation when we have these conversations. And we use them for all of these instances. And so it's part of the reason it's one of my favorite topics is there's so much to talk about here, and there's so much kind of truth to uncover. There's so much important stuff in there for all of us to know. So this is a super busy slide. We're gonna pare it down. So over here you see kind of the ibuprofen, naproxen, the NSAIDs that we talked about. You see up on top in the orange, you see the kind of long acting options. In green, you see the pill. Everybody knows the pill. There's a couple other options that we'll kind of talk through. You'll hear us talk about condoms every time. It's condoms and abstinence are your two choices for STD protection. We talk about it all the time. This is a no judgment zone. Everybody gets to hear the spiel. So we're going to start at the top. We're going to start with our orange options. These are our long-acting options. So these include the IUD. The classic IUD that you hear about is the progesterone-only IUD, the Mirena. You'll also hear about the copper IUD. This is one of the few, really the only non-hormonal option that we will talk about.
Yeah.
And then the implant, the Nexplanon, is the other one that's kind of this long-acting set it and forget it option, which is fantastic. Each of these, we'll talk about how long they last, but you don't have to think about them every day. You just get the thing and you kind of move on from there. And they're great options for pregnancy prevention. They also really help with periods. So we'll talk about Nexplanon first, the implant. This is a small flexible rod that's put in just under the skin of the arm here. We put it in during an office visit. We use numbing medicine. It's really kind of an in-office type procedure. The implant has been approved for 3 years, but they're looking at 4 years now. And it's fantastic pregnancy prevention. All of these options will often have a little bit of spotting in the beginning as your body's kind of settling into them. But as they go, as your body kind of adjusts, periods tend to get lighter and less painful over time. Let's see if I was going to tell you anything else about that one. Oh, the next one is a progesterone only option. So we'll kind of talk about the different types of hormones that could be in these medicines and kind of their different levels. So the Nexplanon has only progesterone, just one hormone, and it has generally less circulating hormone than most of the other options, but a little bit more than our next option, which is the IUD. So like we talked about, the copper IUD has 0 hormone. It lasts 10 years, which is fantastic. It's fantastic pregnancy prevention. For most people, they notice it to increase the heaviness of their periods and increase their cramping a bit. So for a lot of the reasons that you might come in and talk about the IUD, it's maybe not the most ideal option, but for people who cannot have hormone, it's a great option. It's one of the few options out there. The kind of regular IUD, the progesterone only IUD, is the one you'll hear the most commonly. It's the most common one you'll hear about is Mirena. It's been approved for 7, looking at 8 years, and it's super effective for pregnancy prevention. In fact, the data says it's a little bit more effective than getting your tubes tied. And obviously the IUD is not permanent like getting your tubes tied. It again, we'll have a little bit of spotting a lot of times when you first kind of get it and kind of get settled into it. But for the vast majority of people, their periods decrease a ton. The cramps, the bleeding, and a large chunk of people's periods go completely away. So that's often a nice option for people. We do not put those in at Allegro. So that would be either OBGYN, local OBGYNs in the area, or Seattle Children's has a clinic that does them too. And they work really well on kind of pain control. People get a little nervous thinking about the idea of getting something, inserted, but they do a great job with kind of managing all of that. So it's a nice option for a lot of people. And one more polling question. This one, I predict y'all will already know the answer just based on the way that I phrased it. But it is definitely accurate that if you don't like your birth control, you can stop it at any point. You can exactly. Y'all knew that. And if there's something that doesn't feel quite right, come talk to us. We'll troubleshoot it. We'll figure out, what's the next best step. So this was our, there we go. This was our orange options. Moving on to our green here, these are the ones that are less of a set it and forget it, something you got to think about once a day, once a week, once a month, kind of depending on which one we're choosing. All of these options do have hormone in them, and we'll kind of delve into that a little bit more. So this is, I talk about the pill, the patch, and the ring, kind of all in one. They all have both estrogen and progesterone in them, so they have two hormones in them. And the pill, obviously, you take every day. The patch you replace once a week, and the ring, its most common brand is the Nuva ring. It's something that you insert into the vagina and you change it out once a month. So all of these have the two hormones in them, and they work great for period regulation. It's one of our top choices for just pure period regulation. They are great for acne control. We can use them to skip periods if your periods are particularly bad. And we have no safety concerns about this. It's been well studied. There's no effect on future fertility. Potential other questions that come up a lot for people. The studies have not shown an association with weight gain, except maybe for the depot shot. We'll talk about that one in a minute. But what some people notice is that probably the estrogen part of this drives a little bit of increased appetite. And so when you're first kind of settling in, that may be something that you kind of take into consideration as you're trying one of these. People ask a lot about like cancer risk. So in the beginning, the pill has been around for 60, 70 years, long time. When we were first using it, so over time, the amount of hormone and kind of the sophistication of the hormone has improved. So in the beginning, there were some studies where there was a concern for an association with breast and cervical cancer. What it really seems to taper out to is that most of this was associated with HPV virus infection. So yay, HPV vaccine. But the studies more recently have not shown an association, and they've actually shown a decreased risk of endometrial and ovarian cancer. So your net effect is actually cancer protection. Studies continue to be ongoing. So it's something we always keep a close eye on. You may also hear about estrogen being a pro-blood clot. And that's the reason that there's an increased risk of blood clots during pregnancy, in fact. So that increased risk really seems to need to be triggered by something else. So like a family history, everybody in my family had blood clots. Oh, we gotta delve into that a little more. You undergo major surgery, they put the leg squeezy things on you. The one that comes up a little more commonly for us is people that have migraine with aura, so headache with other things, sparkles in vision, you get a loss of vision, kind of those kind of things. Those people seem to have a little bit of increased risk of blood clot. And so for those people, we tend to use the methods that don't have estrogen in them. So IUD, Nexplanon, those are kind of top of our list of great options for people with a slightly increased risk of blood clots. There's also, there we go, the depot shot and the mini pill, which is the progesterone only pill. So the depot shot is once every 3 months. It's an injection. It tends to decrease your periods and often make them go away. There might be a slight association with weight gain with the depot shot. It's not huge, but it's something to consider. And then the other thing is long term, if you're using it for many, 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 many years, maybe we're kind of looking at what that might do for bone density over time. So the official guidelines say take your vitamin D, do exercise that puts pressure on your bones, helps improve bone density, kind of the heavy lifting or kind of weight bearing type exercises, and make sure you're getting calcium foods, which really is good advice for all of us. And then the the mini pill, they call it, the progesterone only pill. It is another one that you take every day. Because it has less hormone in it, you have to be a little more cautious about taking it at the same time every day. The same goes for the combination pill, but the progesterone only pill is a little more sensitive to it, both in terms of kind of the effectiveness of controlling your cycle, but also the effectiveness in terms of pregnancy prevention. So we fairly set a good timer with that one. But it can be used very similarly. It can be used to decrease periods. For people that need full period suppression, it does that. Its effectiveness in pregnancy prevention is almost as good as the combination pill if you're taking it all the time. And for all of them, the effectiveness is increased when you use a condom with it too. So that's always our recommendation. There is now an over-the-counter version of the progesterone only pill, which is brand new. Here it's available at Target even, but it just barely is coming out. So it's an exciting over-the-counter option. And so options that are available at Allegro. All of our providers are trained in all of these green options here. And we have a team that is trained in doing the Nexplanon, which if it's something that y'all are interested in, when you called, you would just say you were interested in Nexplanon and they would help you find the person in the office closest to you that is trained on it. This is a list of some of my top resources in terms of learning a little bit more, being able to delve into it a little bit more. They're very user-friendly websites, so they've got a lot of good way you can kind of sort by your top priorities when you're trying to pick either menstrual regulation or birth control type options. But again, we would love to talk to you guys about this and kind of help figure out what's going to work the best for you and kind of personalize it. So I think, have some time for questions.
Great, thank you. First question here that we have is, will skipping a period using the pill make periods heavy later on when you don't skip?
It's a fantastic question. So as your body adjusts to being on the pill, and your periods will tend to get lighter over time and it gets easier to skip. It could be that in the beginning, when you're first kind of trying to skip periods, sometimes you'll notice some breakthrough bleeding or some kind of irregular bleeding. As your body kind of adjusts, your body will be able to skip periods without having that breakthrough bleeding. So yes and no.
Okay, great. Our next question is, are period symptoms and how heavy your period is that something that's genetic? So if your mom has a heavy period, are you going to have a heavy period?
Fantastic question. Also a yes and no question. It is definitely more common that, especially on the maternal side, if your mom's period, for example, started early, or grandma and aunt, everybody's periods are really heavy, they're really crampy and painful, it is more likely that your periods will kind of be that same way. There's no guarantee. We are all individuals, but it is more likely.
Okay. And then one last request here, unless anyone wants to submit any other questions, as someone is requesting, just to go over the kind of effectiveness of progesterone only versus progesterone and estrogen for the pill specifically.
Absolutely. Fantastic question. So I like this chart. It's not the exact detail that you're asking for right here, but our long-acting options are just super duper duper effective. When you look here at kind of our middle zone, our green zone, they are much more dependent on, I guess, user error is maybe the right way to say it. So it's often tough to remember to do these things at the exact same time. And all of them, if you are able to use either pill, the estrogen and the combination pill or the progesterone only pill exactly as prescribed, they will be equally effective, which is quite effective, about just like it's here, about 6 to 9 per 100. But the progesterone only pill is a lot more sensitive to it's a couple hours late, versus the estrogen and progesterone is a little bit more flexible. It is true for both that the closer you take it to the same time, the more effective they will be. And you would notice if you were taking either one, that if you were probably about 2 to 3 hours off for the progesterone only and about 3 to 5 hours off for the estrogen and progesterone, a lot of people will notice kind of some breakthrough bleeding or some spotting if that's happening for multiple days in a month. So a lot more dependent on yeah, I guess user error maybe is the right word. Great question.
Great, thanks. So we do have actually one last question here. So we have a parent saying that her daughter is very excited to get her period and looking for, what kind of signs they can expect before its arrival. And then kind of another question along the same lines is, should you kind of, wait to see until a period kind of regulates a little bit more before you start looking into some of these other options, or when is the best time to start kind of talking about this?
Awesome questions. So in general, what we expect is, I guess we'll do a quick run through. Do we have a few minutes?
Oh yeah, go for it.
All right, cool. So in general, puberty timing, the exact timing is pretty variable, but puberty signs can start as early as kind of 8 or 9, ideally later, but it could be within the normal range. The first thing you'll usually see is breast development. That's kind of your first sign. And then about 2 years later is when we expect period to start. And during that time, you notice more and more puberty. You notice more hair, you'll notice more growth spur, hormone type, I'm it may be that I forgot to mention PMS control. PMS control is the best with the green options. The orange options can affect it a bit, but your green options are a lot more effective in terms of control of PMS type symptoms. So yeah, about 2 years from when breast development starts is about when we expect periods to start. And then in terms of when we intervene or when we think about helping, it's typically for that first year or two, we like to kind of let your body figure it out and kind of see how things go. If sometimes there's a reason to think about it sooner during that first year or two. If periods are super duper heavy, if they're super duper painful, you're out of school for a week, a month, it's not practical. If periods are causing a lot of like mental distress, that kind of thing, then we will look at what we can do to help in that first year or two post period starting, but we're a little bit more careful in the options that we choose, and we'll have a little bit more kind of detailed conversation about kind of risks and benefits. And if we start hormones early, sometimes we can affect your height. We're not going to affect, it's not going to mess up your fertility or your puberty or anything like that, but you're still growing a little bit in those first couple of years too. So that's one of the things that we talk about when we talk about needing to help things out in that first year or two. Usually we kind of let your body figure itself out during that time.